Hi guys, welcome back to my channel, and for today's video we are going to talk about medications or common medications in Med-Surg floor. Okay, so in my previous vlog I've talked about the common medications that you can find or you can found in a SNF or skilled nursing facility, and this time we are going to talk about medical surgical. But mind you guys, I am working in an adult surgical, but somehow we have some medical cases, but we don't have much of the cardiac cases on the floor. Usually what we get as medical cases are those who are or who were in a CHF exacerbation, AFib, shortness of breath, weakness, something like that, but not much of those stroke type of cases. So in adult surgical floor, of course it's an adult surgical, and you can expect that it's always a post-op or surgical cases. And yes, we have tons of surgical cases from general to ortho, hysterectomy, OB-GYN, urogyn, bariatrics. Those are the kind of cases that we usually get in my floor. Okay, now I have my cheat sheet here because we're gonna talk about a lot of medications that we usually have in medical surgical, but most of, again, surgical cases. Now let's start with pain meds. Of course, we have the well-known Tylenol or the acetaminophen, ibuprofen, Dilaudid or the hydromorphone. Again, Dilaudid has different kinds of dosages from 0.5, 1 milligram, 2 milligrams. It depends on what they ordered. But usually Dilaudid is always an IV meds, okay? And always be careful not to push Dilaudid fast, okay? Because this is can cause a respiratory depression. Okay, so we push it slow and make sure you check your blood pressure. Next is morphine. As you all know, morphine, oxycodone or OxyContin. I've discussed that in my previous vlog in SNF, that oxycodone has different kind of dosages from 5 milligrams, 10 milligrams, 15 milligrams, okay, and it's a tablet. Next will be Percocet or oxycodone plus the acetaminophen, and this is also a tablet form, and it comes with a different dosages, and it's also like a Norco that you have to make sure to check your dosage. Next will be the fentanyl, but not all the time, but because there are some patients who has allergies with tons of pain medications, and some only has this remaining fentanyl that they can only use. Okay. Next will be muscle relaxant. So we have a lot of muscle relaxant too. We use Flexeril or cyclobenzaprine. It is mostly a tablet form, and Roboxin or methocarbamol. It can be a tablet form or an IV bag. It depends on the dosage. And always we have the Narcan, because we have a lot of narcotics, and you know they're always in pain medication, so we want to make sure that we also have Narcan as PRN just in case, you know. Okay, next will be nausea meds, because post-op patients are prone to have the side effects of anesthesias, okay? So they usually have nausea after surgery. So we usually have 3 kinds of medications for that. One is the ondansetron, or we call it Zofran. It's in an IV form or in a vial. Next will be Phenergan or promethazine, and usually it's in an IV bag. The pharmacy will prep it. You just need to order it, or it depends on your hospital protocol. Sometimes they usually have this on hand already, I mean in your Pixies. Next will be Reglan. It's in a vial form too, and you usually give it via IV. Next will be antibiotics. The well-known vancomycin. It's always in an IV bag. It can be a pop-out type of bag, or the one that is already mixed. It depends on the dosages, but you don't need to mind that because pharmacy always prep that. Next will be ciprofloxacin. Next will be cefazolin. Is usually stored in your fridge, in your medication room fridge. So if you're going to find your meds, make sure before you request that in pharmacy, you make sure that you always check your fridge. Next will be Flagyl. It's an IV form as well, or IV bag, and those are the antibiotics. Next will be stool softeners, because we all know that all post-op patients have this tendency that they have a slow or hypoactive bowel movement, so they need some support as well, or they need some bowel prep prior to surgery. Okay, so the well-known Senocot, okay, it's in a tablet form. Next will be the Dococet, which it is in a gel type or a capsule form. Next will be a Peg-Lite, or polyethylene glycol, or we call it sometimes Go-Lite. It's a type of Miralax. So Miralax is a powder form that they also use at most times, but for bowel prep we use this big jar, big gallons, or at least a big jug, a big jar or gallons of a Go-Lite, and they need to like drink that prior their surgery or scope, endoscopy, okay, or colonoscopy. Next will be so those are the categories that are common medications that we give, and these are some of the medications that you can find on the floor. First is the blood thinners, okay, the Lovenox or the enoxaparin. It is being given as a pre-filled syringe via subcutaneous. Next will be heparin. We usually use a vial for this, and we still use, or we give this via sub-Q. Next will be gabapentin. We already know about gabapentin. Next is hydrocortisone or steroids. Be careful and watch out for those diabetic. Make sure you check their blood sugar or monitor their blood sugar because of the steroids. Next will be labetalol. We usually have this as PRN for high blood pressure. It's a beta blocker. We usually just use this if the blood pressure is beyond 180. It depends on your doctor or your internal medicine's protocol on how they manage the blood pressure. Next will be the Gastrographine. Okay, it's a solution. It's actually a contrast medium being used for a Gastrographine challenge for small bowel obstruction. So there are some bowel obstruction that prior doing a surgical management or surgical intervention, they want to try this Gastrographine challenge, or what we call the barium swallow, but we oftentimes use the word Gastrographine challenge. So the patient usually has the NG tube, and then you mix the solution with water. It depends. The pharmacy will just instruct you on how much dilution you need to do, and then you have to instill it via the NG, clamp it. Make sure to clamp the NG first, and then just dwell on it. After like 2 or 8 hours, it depends on the order, the x-ray will come in to take a scan to see if it's working good. Gastrographine is a combination of a diatrizoate meglumine and diatrizoate sodium. So it's a long name, and again, it is being used for a bowel obstruction. And that's it. Aside from that, we usually have telemetry and EKG. We usually do EKG at most times on the floor. Compared to the skilled nursing facility, we don't do EKG. We don't have EKG in a nursing homes. Again, if they have changes in condition, we have to send them out to the hospital. But on the floor, patients who have severe changes in condition or declining, or what we call crash, we usually just call rapid response for them, and then the doctor will assess if they need to move the patient to either progressive care unit or intensive care unit. But that's how we manage patients on the floor, and those are the common medications that we can find in a medical surgical unit. Again, for a surgical cases, mostly unexpectedly, we always have those pain medications, and they can sometimes get as often as every 2 hours or every 4 hours. It depends on the order. For the medical cases, again, I don't have much of the medical cases on the floor. Sometimes we do get medical cases if we have this overflow from the other unit, and then they put usually some of the medical cases to ours. And these are usually either bowel obstruction that doesn't require any surgical intervention, some dementia, fall, weaknesses, or any changes in orientation, or getting more confused patients. It depends, or electrolyte imbalances. Those are the kind of medical cases that we usually get as well. So again, guys, those are the common medications that you can learn and you can Google before you come in here or before you fly here, so that you're gonna be prepared. So hopefully you are able to learn something about the common medication. Make sure to turn on your notification bell for more videos that I'm gonna do. Bye!